So good morning, I'm here with Dr Condry, who is a GP at Wellspring Surgery. Hannah, if you don't mind telling me a little bit about the ways or a way that you work with CAS, so that's sort of particularly through me because I'm the networker for Inner Central and East Bristol, which covers the surgery, where the surgery is based. So in what ways you work with CAS currently, particularly me?
Thank you. So I've been really grateful for your help, both in terms of education and advice. So a particular example recently would be some teenage girls I'd seen who'd recently arrived from Somalia and suffered from really significant trauma. I was trying to help them access some help around that trauma and found that standard services for young people weren't really very suitable for them. The services weren't sure whether or not they could offer an interpreter, and they were being asked to fill an online self-referral form, which nobody in their family had enough written English to be able to manage that. So I asked you for advice, and you provided brilliant advice on services suitable for them, but also mentioned that you were feeding back and working with the organisations who weren't providing such a suitable service to help them improve their access for different diverse groups. So that's one example, but I think generally I find you a really useful resource. I think as GPs sometimes we don't know what we don't know in terms of, first of all, how inadequate services can be for various people facing health inequalities, and also the things which are out there in Bristol. So I think it's really useful to have you as a resource and a contact.
Thank you. Thank you for sharing that. In a way, you've answered a bit of the next question, but if you want to say anything else, the question is, how has working with CAS helped your work, or does it help your work in an ongoing way?
Yeah, it definitely helps. I think there's the example I just gave, but also
Yes.
I found you really helpful in teaching medical students, and I've learned a lot through attending those sessions. So that was in learning about how mental health problems affect different diverse communities, which I feel like I didn't know enough about before, and ways to reach different communities, because I think people don't always come to the GP first of all when they are struggling with their mental health. It's obviously well known that, for example, the classic example is Afro-Caribbean men tend to access secondary mental health care more and primary mental health care less. So I think for GPs understanding that better and about the fear and stigma that people suffer can hopefully help us to do a better job. I also think that learning is really helpful in other communities. Somali women is another good example, where you recently sent me a helpful article about how mental health can present in Somali communities. So as GPs, we'll often see people presenting with physical health problems where we can't find anything on investigation. So particularly Somali women who've suffered significant trauma, such as FGM and their experiences in the war, and they find that difficult to talk about and feel stigma around mental health problems, and so will come to us saying perhaps they ache all over, or perhaps they have a stomach pain where we can never really get to the bottom of it. And I think increasing our learning about that, and also our knowledge of services that are available for them which might be more acceptable for them, is really helpful.
Thank you. And my final question for the morning, I promise you, why do you particularly come to CAS for this kind of support or information? If we weren't there, if you didn't have my email, what have you done in the past, or what would you do?
So often I've just not known. There's been a lot of services which come and go. So in the past, we had specific Somali mental health workers, for example, and they're not there at the moment, which is really sad. So I really hope that CAS will become a permanent service, because I think that is a challenge. But I find that I can't think of anyone else that could provide the kinds of information that you've provided me with. So another example would be recently when I'd seen a woman from a South Asian community who was struggling with her menopause.
Yes.
And I can't think of anyone else who would have known the kinds of information that you were able to send me, which I then passed on to her and she found really useful.
That's great.
So that's why I come to you, basically. And because I always get a good answer, I always get a helpful response. I get, as well as information on what services are there, feedback on perhaps how you're working to improve other services, which I feel is unique to CAS as well. And yeah, thank you.
That's brilliant. Thank you so much, Hannah.